All right, so origin, the pec minor, of course, is going to be the less mobile side. So third, fourth, fifth ribs, which you can see just past the cartilage is where the origin is. The insertion is the coracoid process of the scapula, specifically the medial surface. And you can palpate that on yourselves if you feel the lateral side of your clavicle and then palpate about a thumb width distance. I recommend using like a few flat fingers because if you circle around, you can feel the slippery coracoid process. Also, you can stick your shoulder forward if you couldn't feel it before because that'll make it pop out more. That's our overall eye. One of course with our models. There's our coracoid process, and there's our attachments right there. And so let us say and do the actions together. It's a good review, and saying and doing is a great way to practice and put it into your memory. So depress the scapula. Go ahead and say it and do it. Depress the scapula. Awesome. Abduct the scapula. So remember the scapula, that's the other word for protraction. So you're bringing your scapula forward like when you throw a punch. Good job. So abduct the scapula. Beautiful. Downwardly rotate the scapula. Awesome. And that a good one is if you start with your arm up, then when you bring your scapula, your arm down, your scapula's got to come down with that. Awesome. And with the scapula fixed, this is to elevate the thorax during inhalation. That's a long one to say together. We can just say elevate the thorax. Awesome, awesome, awesome. All right. So questions on any of those actions? All right, let's take a look at the trigger points.
So like those actions are like opposite of what you think you're actually doing.
How so?
Because starting upward to downwardly rotate your scapula, you're not just like this all day. So I'm like, it's opposite of what you think you would have to do from an anatomical position.
Oh, okay. Yeah. Some of these movements don't make sense till you start in a different position. Yeah. All right, let us look at the trigger points. And let me make sure. Yes. Let me make sure. Yeah, we're optimized for video clip.
The pectoralis minor muscle. The pectoralis minor is a small muscle that lies beneath the larger pectoralis major in the lateral chest region. The location of this muscle is in close proximity to the brachial plexus of nerves and arteries that exit the trunk to supply the arm. This muscle functions to position the shoulder girdle for movements of the shoulder joint. It may also assist inhalation by lifting the rib cage.
All right, so let's actually take a look at that. So here is the brachial plexus traveling immediately deep to pec minor. So what do you think that implies clinically? Awesome, excellent. What else do you think might be clinical implications of having the brachial plexus travel right there under the muscle? Anyone but Jill. There could be, yeah.
Like the nerve endings in it.
Yeah, it definitely has to do with the nerve endings in it. That's all right. It's Monday. You're doing great. So because the nerve bundle travels under that muscle, it can easily get compressed by that muscle. So in which case, of course, you could have all the nerve symptoms of the numbness, tingling, right? So sometimes when people have like, whether it's diagnosed or not, it could be diagnosed as thoracic outlet syndrome or sometimes misdiagnosed as carpal tunnel syndrome. Anytime your client has that numbness, tingling, traveling down their fingers, you think about any of the muscles that could be pressing on the nerve. So it could be, do you remember the one coming out of this, the transverse processes of C1, 2, 3, 4? Yes, excellent. And then there's another one that travels out the transverse processes. We didn't focus on it too much yet, but we've talked about it.
Biel just said.
Yeah, that one's a little more superficial, so not as much. But yeah, the levator for sure, and then the scalenes, and now pec minor could all be pressing on that bundle and sending nervy signals. Now, this bundle, these nerves also travel with arteries and veins. So you could have more nervy symptoms and or you could have more vascular symptoms. So also if the person has like their hands goes cold or blue, that could also be from that. So the good news is that like, you know, even if the client has some kind of a nerve situation, if the muscles and or trigger points are part of the problem, you can often help a lot with massage. And you're going to see this a lot with your clients. Yeah. Does that bring up questions, comments?
That's the one that has the three of them catalysts of the technology.
Yes. Uh-huh.
A picture of the muscle that I couldn't remember.
Yeah, I don't feel like we've focused on scaling super hard yet, and it's a little bit more challenging to palpate. So we're going to get there really soon now that your palpation skills are ready for it. Yeah. All right, cool. Let's go back.
Here are the landmarks for the pectoralis minor. First, we have the scapula, the clavicle, and the sternum. The pectoralis minor originates on the second, third, and fourth ribs and inserts on the coracoid process of the scapula. Contraction of the pectoralis minor produces scapular protraction, which is movement of the shoulder blade forward and outward, also produces scapular depression and inhalation by raising the ribs. The pectoralis major is synergistic during scapular protraction. The latissimus dorsi is synergistic during scapular depression, and during inhalation, the levator scapula, scalenes, sternocleidomastoid, and pectoralis major are synergistic. The trapezius and rhomboid are antagonistic during scapular protraction, and the levator scapula is antagonistic during scapular depression, and lastly, the intercostals are antagonistic during inhalation.
And I think when anybody kind of goes over that, just like kind of like a list, it's easy for your mind to zone out and it can be super overwhelming. What I would suggest is that instead you just think about every movement that it does one by one, and then think of any other muscle that does that movement. I don't think you're going to memorize a list like this just by people telling you, right? And one thing you can do is, you know, when you think about the movement, right, you can also just think about like, well, what other muscles attach in a similar direction, right? Because they're going to have a similar line of force. And even when you're taking your licensing exam, you can be touching yourself, feeling the origins, insertions, doing the movements, right? Just really work it out and keep working it out. Keep feeling it in your hands, right? That's what matters. Yeah. Clinical findings for pectoralis minor.
Here are some associated symptoms for pectoralis minor trigger points. Your clients will complain of pain in the anterior shoulder and chest regions. A tight pec minor muscle can also cause neurovascular entrapment in the armpit region, and this can cause pain, numbness, tingling, and edema or swelling along the inside of the arm, forearm, and into the hand. Trigger point activating and perpetuating factors for the pec minor include car accidents, impact trauma directly to the chest, use of crutches, severe coughing, high levels of anxiety, carrying a heavy bag with a strap over the shoulder, and the head forward rounded shoulder posture. Referred pain from both the pectoralis major and the scalene trigger points is very likely to activate trigger points in the pectoralis minor muscle.
All right, this part, let's do misdiagnosis, sorry.
Some common misdiagnosis for active trigger points in the pec minor include thoracic outlet syndrome, C7-C8 radiculopathy or disc herniation, bicipital tendinitis, medial epicondylitis or golfer's elbow, and supraspinatus tendinitis.
All right, so let's, I think on this one, she will do the trigger point release.
To locate and release the pectoralis minor trigger point, begin with the client supine and ask them to place their near arm palm up on the upper part of the table, and if they're female, ask them to cover their breasts with the other hand. Sit or stand next to their armpit region. Grasp the outside margin of the pectoralis major muscle and displace it towards the client's chin. While holding the flesh back with one hand, slip the fingertips of the other hand very gently underneath the pectoralis major muscle.
So this one's harder to do on yourself, so you might be able to do it with a Theracane. Pec major is so thick and strong that it's hard to isolate going through it. So basically we're going around it. So on the side of the chest, you want to go around pec major, and then pec minor is usually very, very tender. So you want to go nice and slow with it and just ease in. And yes, go ahead.
The pentagraphs, whether it be like the C or the S.
Oh yeah.
Movement that we use on our kids.
Yeah, you could totally do Golgi tendon organ release on this muscle. You could do a SIBO, ESBO, yeah, or you could do prolonged ischemic compression. You're not going to be able to reach like the entire length of the muscle, but you're definitely going to be able to get up in there. You're just going to go really slowly because it can be very tender. Yeah. Yeah. Any other questions on this one? And so we'll show you these on lab today.
To confirm that your fingertips are contacting the pectoralis minor, ask your client to raise their shoulder off the table momentarily. You should feel the muscle contract as they do so. The trigger point typically lies over the third rib and refers pain to the anterior shoulder and to the chest regions. Use client feedback to help you locate it. Using your fingertips, apply pressure to the trigger point at a downward angle towards the table. Hold the pressure for 6 to 8 seconds and repeat 4 times. Slowly remove your hands when you're finished.
That last little bit is easy to overlook, but it's such a tender muscle that you just want to ease out as slowly as you ease in. Yeah. It's a hard one to do on yourself in that position, but you might be able to. Yeah.
Well, I feel something contracted down there.
Yeah. Yeah.
With the client supine, grab the bulk of the pectoralis major muscle and pull it towards your client's chin. With the other hand, reach underneath the pectoralis major muscle with your fingertips to the pectoralis minor trigger point. located directly on the third rib. Apply pressure down towards the table and hold 4 to 6 seconds. Release very slowly and repeat, pulling the pec major back. Reach underneath, directly on top of the third rib. Apply pressure down towards the table and hold. And then release slowly.
And you'll literally be able to feel the rib when you're doing that. Just nice and easy.
Repeat this whole procedure 4 times.
4 times.
Like this for?
You have a little really done.
I've definitely seen practitioners who do that. All right, so there we have the visual that's in your PowerPoints of this trigger point. And right, just keeping in mind that this trigger point pain pattern for pec minor often goes all the way down the arms. You can see there's a part that's localized, oftentimes the most common part, right over deltoid. So then we can see that, right, that might irritate deltoid. So we would want to check deltoid for trigger points as well, right? So let's take a minute like we did last week, and first by yourself and then in a small group, you're going to figure out what are the synergists to pec minor, what are the antagonists to pec minor, and what are the muscles in the region of the pain pattern. And those will be your other most likely muscles to have trigger points. Make sense? Questions?